Okay, so let's talk about something that's super important but honestly doesn't get enough attention. Pelvic Inflammatory Disease, or PID for short. It's a condition that can have some really serious, life-changing effects, but a lot of people have no idea they're even at risk or that they might already have it.
And look, if you think this is some minor issue, get this. Both the World Health Organization and the CDC have called PID a major preventable cause of infertility across the entire globe. That word, preventable, is everything, and it's exactly what we're going to unpack here.
But here's the really scary part, you know? The reason it's so dangerous is that it's silent. It's a pretty common infection, but the symptoms can be so mild, or sometimes there are no symptoms at all, that many people just don't realize there's a problem until some real damage has already been done. So, what in the world is actually happening in your body when PID gets a foothold? Let's, peel back the layers and see how this whole thing actually develops.
So, in simple terms, PID is basically an infection that gets into the upper part of the female reproductive system. We're talking about the uterus, the fallopian tubes, and even the ovaries. It's an internal infection that can cause some pretty widespread and damaging inflammation.
So how does it even get up there? Well, the best way to think about it is like an intruder climbing a ladder. It's not like the infection just magically appears in your uterus. Nope. It starts way down low in the vagina or the cervix, and then it literally starts to climb upward, first to the uterus, then it keeps going into the fallopian tubes, causing inflammation and scarring the whole way. And that scarring, that's the real problem, because it can create all sorts of dangerous blockages. All right, this is a big one. How do you even know if you have it? Recognizing the warning signs is your best defense. But I'll be honest, it can be really tricky because the symptoms are all over the place. You know, when you go to the doctor, they're often looking for what they call the classic triad of symptoms. Think of it as the big three: pain in your lower abdomen, a fever that's over 104 degrees Fahrenheit, and any kind of vaginal discharge that just isn't normal for you. If you've got those three together, it's a huge red flag for PID.
But here's the thing, it's not always so neat and kitey. The infection can throw a bunch of other curveballs at you, like pain during sex, feeling nauseous, your period's getting all weird, or even just having that general feeling of blah, just feeling really unwell. That's why it can sometimes get mistaken for something else. And there's this one sign, it's pretty wild actually, that doctors look for during a pelvic exam. If there's this specific kind of tenderness around the cervix, the pain can be so sharp, so sudden, that it has a nickname, the chandelier sign. Yeah, the idea is that the patient might literally jump up towards the ceiling. It's a huge, huge clue that there's some serious inflammation going on. Okay, that was a lot of symptoms, I know. So to make it way easier to remember, just think of the word painful. P for pelvic pain, A for abdominal tenderness, I for infection or fever, N for nausea, F for foul discharge, U for urinary discomfort, and L, the big one, loss of fertility. It's just a great little trick to keep all those key signs in mind. Okay, so we've covered what it is and what it feels like. But the big question is, where does it even come from? Let's get into the causes and the things that can really ramp up your risk. So, the main culprits? Overwhelmingly, we're talking about bacteria from sexually transmitted infections. Chlamydia, that's the big one, the most common cause by far. And right behind it is gonorrhea. Now, other bacteria can sometimes be part of the mix, but these two are the primary drivers. So, who's most at risk here? Well, the data really points to a few key things: being sexually active, especially if you're under 25, having more than one sexual partner, and not using protection. And listen to this, douching is a big one. It might seem like it's cleaning things out, but it can actually do the exact opposite. It messes with the natural balance and can literally push bad bacteria upward into the reproductive tract.
Okay, after all that, I know it sounds pretty scary. But here's the good news, and it's really important news. PID is absolutely treatable, especially if you catch it early. So let's talk about how doctors figure it out and what the treatment actually looks like. The main weapon against PID is antibiotics, usually a combination that can knock out a bunch of different bacteria. If it's a milder case, you can usually handle it at home with pills and maybe an injection. But if things are more serious, or say if the patient is pregnant, then a hospital stay is often the way to go. That's so they can get stronger antibiotics directly through an IV for a more aggressive treatment. Now, while doctors can get a really good idea of what's going on from symptoms and tests, the absolute 100% gold standard for a diagnosis is a procedure called a laparoscopy. It's a minimally invasive surgery, and it lets the doctor literally see inside with a tiny camera to check out the inflammation and any scarring firsthand. There's no guesswork at that point. And that brings us to what might be the most important part of this whole conversation. We need to talk about the long-term stakes, but even more importantly, the power you have to make sure this never becomes your story. So let's just cut to the chase. How serious is the risk to your fertility? The answer? It's really, really serious.
Just look at this number, 60%. That's the potential risk of infertility after someone has had PID just 3 times. That's a staggering number. Every single time you get this infection, it creates more scar tissue in the fallopian tubes. And that scarring can make it nearly impossible for an egg to get through, which can lead to infertility or even a really dangerous ectopic pregnancy. But, and this is the but we've been building to. Remember what we said right at the start? This is preventable. So here's your prevention toolkit, the things you can actually do. Using condoms and using them correctly every time, that's number 1. Getting screened for STIs regularly, that's not optional, it's essential. And if you or a partner ever test positive, you've got to get treated right away to stop those bacteria in their tracks. So that's what we'll leave you with. PID is a silent threat for sure, but it is not a foregone conclusion. It is preventable. Knowing the risks, seeing the signs, and using these tools, that is how you protect your health and your future. So the question is, are you taking them?